Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. Joining us today, we're pleased to have Dr. Aaron Yao, a researcher at the University of Virginia School of Medicine and the UVA Cancer Center. Welcome, Aaron, and thanks for being with us.
Hi, pleased to be here.
Well, we want to talk with you, Dr. Yao, today about some remarkable and in some ways distressing research about the battle against cancer in some rural communities. But before we get to that, Aaron, please tell us a little bit about yourself, where you're from, your family, where you attended school, personal interests, things like that.
I'm a country boy. I'm from rural China, and my parents, they don't even read or write Chinese, but they invested a lot in my education. I got many years of education. I did my PhD at Penn State. And before I worked at VCU Medical School, and now I'm at the UVA at the School of Medicine. And so I do a lot of health policy research. And so I have a family here with my wife, and my 6-year daughter just started the kindergarten. A lot of troubles. And I serve at our church. I do so work, family, and church every week.
Sounds like a busy schedule. And your parents
Yep.
in China, what you said they're farmers, is that correct? And what for our listeners, what province of China are you from, and where is that geographically in the country?
Yes, so I'm from Anhui province, and from a city called Wuhu. Wuhu, it's about 3 hours west of Shanghai. So if you've been to Shanghai, then you know where it is.
Well, now that you're at UVA, Woohoo sounds not too different from Wahoo Wahoo.
Yeah, Wahoo.
So, in addition to being a medical researcher, Dr. Yao, you're an assistant professor at the UVA Medical School in the Department of Public Health Sciences. How long have you done academic research, and what are some of your primary focus areas of study and analysis?
So I started my PhD program in 2008, and I started my researcher career at VCU, I think at 2013. So I've done almost 10 years of research on healthcare policy and administration. So I tend to use cancer care as an example to study the healthcare delivery system and policy making. So my focus is really about rural healthcare because, of my background, the rural healthcare is really dear and near to my heart. I really want to improve healthcare for the rural residents. And then secondary focus is about homebound patients. Those people have lots of chronic conditions and have problems to go to doctors or hospitals. I really want to reinvent healthcare for them so they can have quality healthcare. I do a lot of research about house calls, the good old days, doctors go to you, things like that.
And now I know that one of the things you've advocated for, sort of as a stand-in or replacement for the traditional house call, is the use of telehealth, which I know UVA is very engaged in, to reach people who are in farther flung areas who may not be able to get to a healthcare facility with some regularity just because of the distance and the remoteness of where they live. So I know that's something that UVA is engaged in, and that's something that you advocate for as well. When people think of healthcare, a lot of people think of clinicians like doctors and nurses, but we know, you and I, that there are so many more aspects of the profession, and that includes the kind of population health research that you do. Share with us, if you will, your thoughts about why this area of work you find it so rewarding, and why, furthermore, it's so important to overall community health and well-being.
Thank you. First of all, let me clarify a little bit about your comments about house call. So we're not replacing house calls. We're, enhance it, and actually we want to marry technology with house call programs. And then your question, I think for clinicians, healthcare professionals, they deliver healthcare And as a population health scientist, we deliver science. Um, just like the doctors, they rely on our scientists to deliver evidence so they can practice evidence-based medicine. Then for population health, we also need evidence and science so we can, planning healthcare delivery, we can inform healthcare policy making. So as a population scientist, we have to dig the data and use very rigorous research skills to find problems and identify solutions and make recommendations to healthcare practitioners and policymakers. So I mentioned my paper. It's about the rural Appalachia cancer disparities. We found that some part of rural Appalachia, their cancer disparities is almost 40% higher than the rest of America. It's very, surprising and to a lot of practitioners and policymakers. So that's an example of population science research.
And you mentioned that paper and that research study that was recently published in the Journal of Rural Health, and it focused on rural Appalachia, which is a region of the country that stretches from lower New York State all the way down to touching portions of deep southern states like Mississippi and Alabama. And what the headline of your research is that region over 50 years has gone from having the lowest cancer death rate in the country to the highest in the last 5 decades. That's one of several troubling trends about cancer care, from screening to diagnosis, treatment, and survival, that your research found is at odds with much of the rest of the nation when it comes to advances that have been made in combating cancer. If you would, please share a little bit of the background about how this research, you came to focus on this in particular, and what sort of you and your colleagues have identified as next steps to try to reverse some of these troubling trends.
So my team, we have done a lot of papers on rural Appalachia, like over 10 papers about the disparities in the Appalachia. Sometimes we write about screening, sometimes we write about treatment, and other times it's about mortality or survivorship. And then I thought, I really need to do a research to document the disparities across the continuum of cancer care from the beginning to the end. I mean, from the risk factors, incidence, to early detection, to treatment, survivorship, and mortalities, to show that the disparities is not at just one step of or one process of the cancer care continuum, but it's actually across the continuum of care. So that's how I started the data analysis, and took us a few months to write it and then find to publish the paper. In terms of next steps, so in order to, of course, we want to reduce the disparities and solve the problem, but as most of our listeners or readers know that healthcare only determines about 20% of our health. So the rural Appalachia disparities in health is, a lot of them are rooted in their economy and the other social problems, and we can improve healthcare by improve their cancer screening resources. We're designing an intervention project to give them annual wellness care and improve primary care and preventive care, and to improve early detection. But we have lots of problems with the screening resources. I recently did analysis, but it's not published yet. But in those counties with high smoking rates, they tend to be poor, so they don't have lung cancer screening resources, the low dosage CT screening facilities. For example, in Virginia, the low dosage CT screening facilities are concentrated in Charlottesville, Richmond, and Beach, Norfolk, and Northern Virginia. And then you go to southwest or to the south, then they're not you just don't find the screening facilities. Then how can we solve the problem? And so we're doing policy advocating, evidence-based, and we're also designing interventions. And for the economy and social issues, it's if we look at the history, Appalachia is dependent on tobacco and coal mining industries now because of successful tobacco control, because of the energy industry move away from coal to clean energy. So jobs have left Appalachia. It's kind of also related to globalization. But as I told people that I think the residents in rural Appalachia and people care about them should pick up your phone to call your legislators and elected officials to do something about it instead of we just suffer from the globalization and the economy. We can try to take advantage of the globalization to develop a small business. I don't think the manufacturing industry would work in a low density area, but small business might work in a global economy. And it's interesting for me to think about the last election. And if you look at the map, and you will find that all the disparity counties are red counties. But I think it's solving problems in Appalachia shouldn't be a partisan topic or discussion. It should be bipartisan. Democrats and Republicans should come together to solve problems in rural Appalachia, because it's not a third world country. It's part of America. And when we talk about disparities, healthcare disparities in this country, oftentimes we only focus on minorities. I mean, I'm a minority. I know minorities disparities are an important topic. We need to do that. But at the same time, we should not ignore the disparities in rural America. I mean, even they are white or even white males. I mean, we shouldn't discriminate them because of their race or skin color, right? So I would, recommend we try to do some bipartisan efforts to solve issues in rural Appalachia.
Well, I think coming together and finding healthcare policy solutions that are common sense and that provide widespread access to care, including in underserved communities, is something that many people can agree on. And we appreciate you bringing attention to those issues and look forward to your forthcoming and continuing scholarly work. And we'd love to have you back on the podcast after some of your future research is published.
Yeah, that would be great. Thank you.
Well, again, our guest today has been Dr. Aaron Yao, a researcher at the University of Virginia School of Medicine, an assistant professor, and a researcher at UVA Cancer Center. Dr. Yao, thank you for your time today, sir.
Thank you for having me.
During this segment of the podcast, we'd like to share some healthcare stories that we've read. They might have appeared in a newspaper or online, and they're stories that we enjoyed, and we think that if you have a few moments and you're interested in healthcare topics, they would be enjoyable to you and they're worth checking out. So Erin is going to share one such story with you, and she's going to tell you how you can find it through a simple internet search. Erin?
Thanks, Julian. So today's story comes out of Fredericksburg. Sometimes it's the little things that bring us comfort in a moment of despair. A heartwarming story in the Fredericksburg Freelance Star shares a wonderful example of how seemingly small things can help us heal emotionally. The article shares a story of an expectant mother whose excitement about her pregnancy turned to devastation when her baby girl was unexpectedly delivered at 5 months and tragically did not survive. Thanks to the work of an alert coordinator in Mary Washington Hospital's perinatal loss program, a recording of the baby's heartbeat was captured before delivery, and a small playback device with that heartbeat sound was implanted in a stuffed bear as a keepsake for the mother. Over time, the grieving mother found comfort and solace in the bear that played the sound of her daughter's heartbeat. And almost 10 years later, after learning the hospital program that provides the stuffed bears to mothers was running low on supplies, she emailed the program coordinator to share how much that bear had come to mean for her, and to ask if she could help organize a fundraiser for the program, which she did. As a postscript to this story, that woman who lost a daughter later became a mother to a precious little girl who treasures the stuffed bear just like Mom. To read this story, you can search online for the Mary Washington Perinatal Loss Program.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VHHA, using the hashtag PatientsComeFirst. Thanks.